Today is World Health Day, a WHO led global health initiative. And here's something worth knowing about it. This is not a general United Nations Day. It belongs specifically to the World Health Organization, a specialized agency within the UN system, which created this observance to mark its own founding on April 7th, 1948. Think of the UN as a parent organization and the WHO as a dedicated branch focused entirely on global health. World Health Day is the WHO's event, running under its theme with its own campaigns and a specific call to action.
That matters because the WHO's work is directly tied to the United Nations Sustainable Development Goals, a framework of 17 global goals adopted unanimously by all 193 member nations in 2015, covering everything from ending poverty and hunger to ensuring good health, clean water, and quality education for people everywhere. The United States formally supported those goals under the Obama administration, calling them both morally sound and strategically smart. But in 2025, the current administration formally rejected the Sustainable Development Goals framework entirely, and in January 2026 withdrew from dozens of international organizations within the UN system, including the WHO itself.
When the United States ultimately reengages, steps back further, or charts an entirely different course is a question that shifts with every election cycle and every administration. That makes this moment part of a much larger geopolitical story about who shows up for global cooperation, who steps away, and what that means to the health of people around the world.
So, is World Health Day a WHO day? Yes, absolutely. Is it a UN day? Technically, yes, in the sense that the WHO is part of the UN family, but the UN itself did not create it and doesn't run it the way that the WHO does.
It's similar to how UNICEF runs World Children's Day. That's a UN day, but it's really UNICEF's event within the UN system.
Let's talk about key 2026 events. Anchoring the 2026 campaign are two major global moments: the International One Health Summit, April 5th to 7th, hosted by the government of France under the French G7 presidency, and the inaugural Global Forum of WHO Collaborating Centers, April 7th to 9th, gathering scientific institutions from over 80 countries. Together, these events form the largest scientific network ever convened around a United Nations agency.
There's a big picture here. Remember the 17 goals that all 193 countries came together and were ready to support? Well, World Health Day aligns with three of them: Goal 1, Goal 3, and Goal 10. Good health and well being, no poverty, reduced inequalities.
In short, today, April 7th, 2026, is World Health Day, and the global call to action is to trust science, support evidence based health policy, and recognize that human health is deeply connected to the health of animals, plants, and ecosystems.
The theme for 2026 is Together for Health, Stand with Science.
The campaign marks the anniversary of WHO's founding on April 7th, 1948, launching a year-long public health campaign. Human health has been profoundly transformed over the past century, largely due to scientific progress and international cooperation.
This theme emphasizes the vital role of science in addressing global health challenges, particularly amid widespread misinformation. It promotes a One Health approach, linking the well being of people, animals, and the planet to create stronger, more resilient healthcare systems.
And so now we'd like to talk about the critical intersection of healthcare, unexplained illness, and witchcraft accusations. Throughout history and into the present day, a lack of medical understanding regarding sickness and causes of death, especially, has served as a primary trigger for witch hunts. When communities lack access to modern medical explanations, tragedy is still often attributed to malevolent magic. In 1647, a severe epidemic swept through Windsor, Connecticut, killing several children of prominent citizens. This community trauma and lack of medical answers ultimately contributed to Alice Young becoming the first person executed for witchcraft in the American colonies.
A similar medical tragedy sparked a witch panic in Hartford, Connecticut in 1662. 8-year-old Elizabeth Kelly suffered from a sudden, agonizing stomach illness and muscle paralysis. Her father attempted to treat her with angelica root. That herb is easily mistaken for highly toxic hemlock, which causes identical symptoms, but we don't know for sure why Elizabeth became sick. But tragically, instead of recognizing a potential poisoning or natural illness, her parents believed her cries that her neighbor, Goodwife Ayres, was magically choking and pricking her.
That dangerous substitution of magical thinking for medical diagnosis is not just a relic of the 17th century. Today, neurocognitive conditions and mental health disorders are routinely misdiagnosed as demonic possession or witchcraft. Barry Holtzhausen, founder of Alzheimer's Dementia Namibia, notes that when people cannot explain why a baby died of diarrhea or why crops failed, they ask questions and conclude it's witchcraft, it's not a disease.
And his colleague, Andreas Mangundu, a registered nurse, also shared with us how symptoms of dementia directly lead to accusations. If an elderly person suffering from memory loss speaks to someone who has recently passed away as if they are still alive in the room, it terrifies community members, and they conclude often that the elderly person is responsible for the person's death, that they're talking to their imaginary presence. These are real scenarios leading to witchcraft accusations and violence today.
The trauma inflicted by these accusations creates a secondary mental health crisis. Women banished to outcast camps suffer from severe depression, anxiety, and PTSD. Peter Minter Amadou, a clinical health psychologist and executive director of the Total Life Enhancement Center in Ghana, TOLEC, travels to these camps to provide essential psychosocial support.
Peter has told us that we need to understand that healing requires a holistic approach. He points out that issues of mental health can be addressed, but the other needs, like hunger, also need to be addressed. His team utilizes a picnic style of therapy in northern Ghana's refugee villages, commonly called witch camps. They dine with the survivors whilst providing mental health therapy, reminding these women that their lives still have meaning and value.
Our conversations with guests like Barry Holtzhausen, Andreas Mangundu, and Peter Minter Amadou demonstrate firsthand how the World Health Organization's call for good health and well-being plays out on the ground. Dementia misread as witchcraft. Women in outcast camps suffering depression, anxiety, and PTSD. A psychologist dining with victims to remind them their lives have value. A nurse offering dementia awareness training to medical clinics.
And you know what? There's another important guest that I really want you to listen to also. J. Mohammed Osman Kamara. He's the executive director of Sierra Leone Association of Persons with Albinism, or SLAPWA. His organization actively promotes good health and well-being by directly tackling the severe physical vulnerabilities associated with albinism, primarily skin cancer and vision impairments. Because the lack of melanin makes the sun their greatest threat, SLAPWA focuses heavily on the provision of eye care and skin cancer prevention.
Persons with albinism in Sierra Leone and countries around the world face intense economic and social marginalization, which often leaves them impoverished and unable to afford basic necessities, let alone specialized preventative health care. Through vital partnerships with international organizations like Medical Assistance Sierra Leone and Pro Victimus, SLAPWA directly alleviates this financial burden by supplying free sunscreen, sunglasses, hats, and sun protective clothing. Failures of health, justice, and protection are not confined to any one part of the world. Here in the United States, 3-year-old Aurelie Naomi Proctor, 13-month-old Amora Bain Carson, and 8-year-old Lila Cassell all died or suffered at the hands of family members who believed they were possessed by demons. Angela Flores killed her children on Mother's Day in 2022 for the same reason. What we see in these cases is the intersection of untreated mental illness, substance abuse, and spiritual and ritual abuse, meeting support frameworks that have not yet risen to address the need. The United States has to answer this call for its own vulnerable people.
These U.S. cases connect the same 3 Sustainable Development Goals. First, good health and well being, because Arlie, Amora, and Lila might be alive today if the adults around them had a strong, easy to reach support network. Secondly, reduced inequalities, because toddlers, young children, and the elderly are some of the vulnerable citizens that face very real barriers to protection in the United States. And we do see it. And lastly, peace, justice, and strong institutions, because building consistent community based support frameworks that can recognize a family in crisis and connect them to real help is exactly the kind of institutional investment the Sustainable Development Goals call every nation, including this one, to make. These examples today are exactly the kind of real situations that the Sustainable Development Goals of good health and well being are written for. We invite you to go listen to our full episodes with each of the advocates that we mentioned today. The links are in the show notes.
Did you learn something? Go tell a friend over coffee or with a social media post this week.